quickly share with you my slides. And we are going to go right into this. So for those that are not familiar with the Risk and Reach project, this is a collaboration between Erikson Institute, the Illinois Early Childhood Asset Map at the University of Illinois, as well as the Fiscal Policy Center for Voices and Voices for Illinois Children. This project could not have been made possible without the support of the following foundations coming together, as well as a group of about 100 stakeholders that really helped to inform the project from ideation to production to now dissemination and usage. What you see on your screen is sort of this multi-tiered structure of feedback. We had an advisory council of about 40 plus individuals representing advocates, funders, General Assembly members, our McCormick Foundation executive fellows, as well as our state agency leaders. We worked really closely with our advocates throughout the process to ensure that the final product would be something that is relevant and useful for the field, but ultimately that could be utilized by our policymakers for the decisions that they're making with respect to substantive policy as well as budget allocations. We worked also really closely with the Early Learning Council of the Executive Committee of the Early Learning Council, as well as the Data Research and Evaluation Subcommittee, the Build State team. And so, as I said, it was about 100 individuals that provided feedback throughout the process so that we can ensure that this inaugural report really was something that is not only digestible, but it is also actionable. I'm going to direct us now to our interactive website. You can download the report there. You can also play with the data of the actual report and look at different reach indicators against different risk indicators. You can visit the website at riskandreach.erikson.edu. And if you have any questions after this webinar, feel free to send us a note. The next thing that I want to kind of share with everyone, just to orient you on the report, is to look at a quick video that provides you with sort of an overview of just the purpose of the fiscal scan. And so it's just a couple minutes and we will start it now. One moment, we're having a bit of a technical difficulty. Okay, we'll actually continue along. Just to, what the video essentially covers is that this inaugural report is a curated set of data indicators representing risk factors that exist in the environment that could undermine optimal child development. And it looks at it in relationship to the reach of public investments to mitigate those risk factors. The report lays the data out in tables as well as heat maps, but then we also have a look at resources, and that is the fiscal scan, and that is essentially the subject of this particular webinar. Looking at the state level, the investments, line by line, agency by agency, related to investments for young children under the age of 5 and their families. I am going to turn it actually over. We're really excited to have First Deputy Governor of Education, Theresa Hawley, join us so that she can kind of a little bit of context, because what's really important as we are thinking about this fiscal scan is that in the next kind of 13 months, the state is going to be undertaking a pretty large initiative in looking at how the financing of our early care and education system could be optimized. And so there's an opportunity for us to kind of understand that while we have this fiscal scan today, it may look a little different the next time we do it, depending on the output and outcomes of this finance commission that Theresa is going to be kind of outlining for us. So Theresa, I'm going to unmute you so that you can speak. And
Great.
I will mute my.
All right, thanks very much, Cristina. And I'm not seeing the slides up there right now, so as maybe you're going to be putting those back up. I see them now, so that's great. So I am excited to be able to talk to you all on the webinar today, and so excited for this fiscal scan to be out there and in the public. What I've been, as Cristina said, lots of partners were involved in the whole Risk and Reach report, and I was lucky enough to be one of the people on the advisory committee to it. Such a great project for our state, and such an important product that we have. The driving thing of the Risk and Reach report, and even of this fiscal scan, is comprehensiveness, to really take a look at all of the funding streams, all of the programs that the state supports across so many different parts of the system that impact the lives of young children and families. So as the rest of the webinar will show you, at looking at everything from families' economic security to health to things like housing, all that kind of stuff, and really understanding how all of this impacts the lives of young children and families. But one subset of that is actually the early care and education services that we provide to children and their families. These are things like home visiting and preschool services, child care services, any kind of thing that it really is about the education and care for young children and families. And folks, I think, on this phone will be no stranger to the fact that we have an incredibly complex, some would say Byzantine system of funding early care and education in our state and in most states in this country, which leads to a lot of challenges with funding stability, with funding adequacy, and with the equitable distribution of resources across communities and across families within the state. So funding is always a root cause of any challenges you may have in a system, or is one of the most important root causes of either getting things right or making things too complicated and too challenging. So we are about going after the big picture and the root causes here, and making some real fundamental changes. So as Cristina said, we're going to be launching a commission, Early Childhood Funding Commission, to really look at how we are funding early care and education in this state. And I know there's been some information out there that people have probably heard and seen, but just want to take advantage of this opportunity to help people understand what we are talking about and what we're not in thinking about this commission. So the commission will be doing some work to, first off, kind of the way that the K-12 Funding Commission was able to put a number out there into the world to say, in order to get to adequacy of education and equity and distribution of resources across our system, there needed to be, $3.5 billion more put into the system over 10 years, and of course that number has grown a little bit, but and get a commitment of $350 million a year to be added into the system every year. In early childhood, we need sort of our number. We need we need out there into the world what our system actually needs to be performing the way we want it to be performing. We've done some work on this. We know that we're funded at probably 20 to 25 cents on the dollar of what we need to be able to accomplish what we set out for ourselves just in early care and education. So we'll be creating a articulation is the best way to say, of the cost of the system that we want. As part of that, we got to be saying that what is the system that we want, so saying what is the scope of early care and education services that we're trying to get to, specifically within home and center-based childcare, center and school-based preschool, and home visiting. And what do we think that really costs if we do it well with the right level of quality and intensity of services and comprehensiveness of services, and with just and adequate wages to have a highly qualified workforce working in the system. So that is a whole bunch of work that we'll be doing on to set that sort of number of the cost and to endorse the methodology by which we're getting there of how much that costs. Another critical question that the Commission will be addressing is whether and to what extent there's a local role in funding early childhood services, specifically early childhood education and care services, and whether there needs to be a local role in distributing that funding. Most funding, as you know, for early care and education services flows directly from the state to providers. So we need to be thinking about that, because we've slowly drifted as a state in terms, especially of the early childhood block grant, of directing dollars by funding tiers like the EBF formula, and prioritizing communities that way without really having the conversation about what is the local role in funding services. And then lastly, really looking at the mechanism of how we get the money out the door, whether and how some parts of the system should be funded through new mechanisms. Should there be some kind of formula? Is RFP the right way to go? Are the certificates the right way to go within the child care system? And so looking at these mechanisms and how we might be able to have more effective mechanisms for distributing funding that really reach our three pillars for success here, which is to have equitable access to high quality services, adequate funding so that services can be a high quality, and stability of services and funding. So that's what the Commission is going to be working on. And the next slide just gives you a little bit of a sense of the timeline that we're working on. Our first meeting is going to be on December 16th. We're looking forward to that and excited about it. We'll be having monthly meetings throughout 2020 with the goal of having a really solid report to the Governor in January of 2021. We know as part of this, there's going to be a lot of work groups that we're going to have to form, or not a lot, but a couple of work groups we're going to form. And we may be involving some additional people beyond just the small kind of tight commission that is going to work on this. But we're very excited about it. Again, it's focusing on this more narrow part of the system. And we do think there are going to be changes, but we think one of the most exciting changes that we can see is really getting out there what it really costs to do this right in the world, so that we can build up to those resources. And I'm excited to see the rest of this webinar to talk much more comprehensively about all the investments that the state is making in young children and their families, which is clearly a top priority for this governor. Thanks. And Cristina, I'm not able to see questions. If there are questions you want to pose to me, I'm happy to discuss.
Sorry about that. I think we're back on with sound. Yes, Theresa, we'll let you know with respect to questions. I'm going to now hand it over to Mitch. Mitch Lifson from Voices for Illinois Children. He was our lead author on the Fiscal Scan, really dug deep into the budget space and essentially put together this incredibly comprehensive and in-depth report. And so I will unmute you, Mitch, so that you can begin to speak. And here we go. Oops.
Well, thank you, and good afternoon, everyone. The hope today is to cover 4 objectives that we have outlined here on the slide. One is to explain the need to understand the funding programs and services for children under the age of 6. 2 is recalling the components that are in the Fiscal Scan tables in the reports. 3 is distinguishing the revenue streams. And 4 is analyzing trends from recent fiscal years. So our funding window goes from fiscal year 2015 expenditures to fiscal year 2019 appropriations. Two things to keep in mind. One, the appropriated amount for a given year may not end up being the amount fully expended for the year. In fact, in a number of cases, because the federal fiscal year differs from the state fiscal year, the state places a higher number in the federal appropriations column as a placeholder until Congress approves the budget. So where possible, we thought it was important to show what was actually spent on the program or service in a given year. Second, you may see some strong fluctuations between fiscal years 17 and 18, and that is likely due to the budget impasse the state experienced between 2015 and 2017, when certain line items may not have received general revenue funds in fiscal year 17, but then in fiscal year 18, there was not only an increase in funding for the item, but authorization to pay bills remaining from fiscal year 17. All right, so as was mentioned, and I'll just review again very briefly, the full risk and reach report has three components to it. One is the risk factors that are those identified indicators that affect child well-being. Two is the reach factors, or essentially the publicly funded programs designed to address those risk factors. And then there is the fiscal scan, which is obviously the money that allows the reach factors to occur. Okay, when we began this project and we started contemplating all of the different programs that touched upon children and their families, it was a very long list, and we had to contemplate how to make this all manageable. So some of the factors that we contemplated were: one, was there data in fact available regarding the expenditures on children under the age of 6? Could we specifically, if there was a larger line item for children, break it out by age? I mentioned the budget impasse and the need to look at expenditures versus appropriations. And then we also wanted to take a look at the full funding sources. So we had to take a look at state as well as federal funding that goes into these line items. So to make it manageable, we had the three categories of family stability, health, early care, and education. And you can see here the risk factors that were determined by the group, the advisory group, and all of those who were working on the text itself. And then with regards to those risk factors, we came up with these reach factors, or these programs designed to address the risk factors. And then again, at the end, we have the fiscal scan, and these are the general categories in which the funding for these programs occur. Now, in general, for the items that are within the report, the services and programs fall into these particular state agencies. That said, again, I want to emphasize that we recognize that there are other services that are delivered by other state agencies for children and their families. Those particular items are not necessarily in this report. They may be in a future report. And then we also recognize that there were some federal programs that were important to consider as part of this whole examination. So in order to do a proper examination of early education, we also had to take a look at the federal Head Start funding. And many of you may know that the Head Start money actually flows to a local program and does not flow to the state. And then because of the importance that it had to the full picture for nutrition and health, we also wanted to include the Supplemental Nutrition Assistance Program. Again, this is one of those programs where the state administers the SNAP benefit cards, but the benefits themselves actually are put on the card and come directly from the federal government. Now, what's not in the scan? These are just a couple of the items that are not in the fiscal scan. And just to give you an idea of some of the obstacles at times that we face, I'll explain why. So Family Care Assist is a program that is designed to provide insurance to parents living with children 18 years old or younger, as well as the relatives caring for children in place of their parents who meet the income eligibility guidelines. But we could not get from the state in a timely fashion all of the households that had children under the age of 6, where the parents were under the Family Care Assist program. The free lunch and breakfast program, again, one of the difficulties we had was having the State Board of Education provide us with the data that indicated specifically benefits just for children under the age of 6. Same issue again with the earned income tax credit. In order to have discerned exactly how much went to households where there was a child under the age of 6, we would have had to look at the federal tax returns and the dependents and try and determine the age of the dependents. I will just note, however, that overall for the state of Illinois, more than 913,000 Illinois taxpayers utilized the state EITC, and that came out to a total of approximately $315.5 million. All right, so whenever we talk about budgets and it gets into the money and gets into the math, people say, why do we have to do that? I really don't like the math. Can we just skip that? Well, the answer, unfortunately, is that because without the budget, many of the programs and services that are on the books would not occur. And we got some insight into that during the budget impasse. These are just a few examples of what occurred during the budget impasse. And you have to ask yourself, if you're a recipient of state funding for programs to children and their families, will you work for free? If your agency doesn't get the money, are your suppliers okay without getting paid? What do you do? Do you have to shut down your program? There are many cases where entities went through a line of credit or a loan, could not do so again, and as a result, during the budget impasse, had to either let go of staff or curtail programs. All right, so eventually we did get a budget, and so we're going to move forward as to how this exercise will work given the budget. So we're taking a look at generally the expenditures for young children and their families. So consider that sort of the big pie. And then within that, we have the different segments for health, family stability, early care and education. And then within each of those programs, we're taking a look at the funding streams or the ingredients that go into that. So in your post-Thanksgiving state, you can think of that meal and how it relates to this presentation. Okay, just a very quick reminder if you're not familiar, the state's fiscal year begins on July 1st and it ends June 30th of the following year. So for example, when we say fiscal year 20, that's the budget that was approved and signed into law this year, and that will run through June 30th of next year. And coming up in February, the governor will be presenting his budget proposal for fiscal year 21, and we'll touch on some of the aspects that the governor will have to take a look at for that towards the end of this presentation. Okay, recalling the Fiscal Scan table. So these tables are also included within the Fiscal Scan, but also in the full risk and reach report. Again, we have the categories, and then within each of those categories, we have different programs. So for example, child care under early care and education. Now, within the full Fiscal Scan, rather full risk and reach report, we have the general line item. What the Fiscal Scan does is it gets into greater detail of the funding stream as well as the funding trends from fiscal year 15 to 19. And for this presentation, we have a little bit of data from fiscal year 20 thrown in. One other item to be aware of, and it was just touched on a little bit by Theresa, is the delivery of services. What agencies are responsible for what services? Now, in some cases, because of federal law, there's a requirement for a certain agency to handle something. But in the case where there's flexibility, part of the question will be, as you look at these programs and services, is there a different delivery mechanism that perhaps might be more efficient? Now, if you take into account all of the state spending for the identified services for young children and their families, the total comes out to $3.13 billion. This is based on fiscal year 18. So at the time we were writing the report, this was the most recent year for which there was expenditure data. And again, we wanted to take a look at the expenditure data wherever possible because that was the true reflection of what was spent by the state for that program and service. Now, the entire operating budget for that fiscal year was $63.7 billion. So when you compare that, essentially the portion that was spent on young children and their families represented just under 5%. I mentioned that there was a need to take a look, we felt, at SNAP and Head Start and Early Head Start. So that brings the total to just under $3.9 billion. Now, what's not included, and again was just referenced earlier, are local dollars. We did not include local dollars in this fiscal scan, but we recognize that they play a role in the delivery of services. According to one survey, approximately 13% of funding on pre-K programs comes from local government sources. So we have a couple of examples here, one from Waukegan. There are also other park districts that provide different child care services. And as many of you know, the city of Chicago has embarked on expanding its pre-K program. So of the total pool of money that it's spent in the most recently available budget information, $60.7 million came from local resources. And then there were other resources from the state and federal government that are added into the pool. What's also not included is money from foundations. So this is just one example here where the Buffett Foundation has committed money for a facility indicator. All right, so when you take a look at the total pool of funds, that $3.9 billion that we outlined, this is generally the breakout of what occurs. A certain amount of time today will be spent on the early care and education segment, but what I want to point out here is that health represents just under half of the expenditures. Again, another item that I want to point out too is that based on the availability of data from this state, there may have been circumstances where this chart would have changed. So again, if we added the Family Care Assist program, that would have altered the health section. If there was some other data available regarding the family stability section, that would have changed as well. Very quickly, this is a look at the family stability section, and really the bulk of the economic support item that's shown here is SNAP expenditures. With regards to child and family support, DCFS did its best to provide age-related data. They did indicate, however, that some of the programmatic expenditures could not be broken out by age in a timely fashion, so to a certain degree, this is actually perhaps lower than what occurs. This is the healthcare and family services section, and I'll get into this in a few more slides, but I just wanted to note for you the large proportion of funding that goes to the All Kids program and the significance that it has for young children and their families. And here's the early care and education expenditure section. Now, what I'll just note here, and we can discuss it later, is the fact that when you take a look at the chart, there is a relatively similar proportion when it comes to the expenditures under the Early Childhood Block Grant Program, the Child Care Assistance Program, and also the Head Start program. Again, Head Start is federal funding, but part of the question here in looking at this chart and how the funding and programs are broken out is there potentially another way to deliver services that may integrate some of these programs? Now, even though I mentioned that $3.3 billion was spent from the state of Illinois, what I wanted to emphasize is that includes federal funding that the state receives and appropriates. In fact, more than 2/3 of the money spent in fiscal year 18 by the state came from the federal government. All right, taking a look further at the revenue streams. So in a general sense, there are three revenue streams that are reflected in this report. General revenues, which are the revenues that tend to come from the state income tax, whether it's individual corporate, sales taxes, are more flexible in terms of what the legislature and the governor can use them for. Other state funds tend to be somewhat restricted, and it might be a specific fee that is collected for a specific purpose. So as one example, somebody may pay a professional licensing fee where the money is designed to go for the regulation of that profession. Now, that said, the legislature does have some flexibility in approving transfers of funds from other state funds to be used for what would normally be general revenue purposes by virtue of when it passes the statute and enabling legislation as well. There are also instances where the state receives federal funds and it puts it into an other state fund. And then there are federal trust funds, which really is money that comes from the federal government designed for a specific purpose. And the state has relatively little flexibility in how it can use those programs. All right, so why look at these three different sources? Well, if you just looked at the general funds, the blue circle, you would get one picture of what the state is doing in any particular area: health, education, childcare. Once you add in the other state funds, it fleshes out the picture, and you can start to see perhaps a different circumstance and patterns. And then once you add in the federal funds, you get the full picture of what's being done. And again, we thought it was important because in part, there have been two trends that have occurred over the last decade. That is, for example, when more federal funds were available for a particular purpose, the state may have decided to shift expenditures from what was typically general revenue funds to federal funds, or it may have decided to change from one agency to another, for example, human services to healthcare and family services, so that the state could potentially get a matching amount of money from the federal government to cover the costs. All right, now the categories and how the funds are categorized, it really comes from the Governor's Office of Management and Budget. So this is just to give you an example of some of what I was talking about. The top chart has to do with WIC, and in this case, it's federal money received from the federal government spent for this specific purpose. They remain federal funds as designated by GOMB. You do have a case, for example, in DCFS, which is the second chart, where there are federal funds coming in for foster care, but that money then is deposited into an other state fund, and that's how it's classified by the state. And again, part of the reason that we thought it was important to include all of these line items was to give the full picture of how the expenditures are occurring. So just to take the area of home visiting, if you had just taken a look at state general revenue funds, you would have assumed that in fiscal year 18, just over $14 million was spent for those services. On the other hand, when you add in the federal funds, you can see that 24.6 million is being spent. So let's take a look at some of the trends that we determined in going through this exercise. And one of the things to keep in mind as you're reading the report, and that's what these next 3 points are really about, is there are some changes, and you should be aware of them as you're reading the report. So the purpose of this chart is really just to demonstrate that there has been inflation, and that $1 in 2014 is worth approximately 95 cents when you get to July of 2019, which is when the fiscal year 2019 budget would have been approved. I meant to say July of 2018. So $241 million in 2014, which is when the fiscal year 15 budget was approved, equates to approximately $255 million in 2018 dollars. And the point of just noting that is that if you just look at the numbers that are in the chart, you would say, oh, well, there was just under a 14% increase in funding. But if you were to make the fiscal year $15 match what the value is in 2018, then you would see really the increase was just under 8.5%. I mentioned previously that you may see some fluctuations when it comes to the budget impasse between 2016 through 2017. And also, I just wanted to note that the federal budget year begins October 1st, whereas the state is beginning July 1st. And so when you get to the FY19 appropriation column, you'll see in some of those federal numbers, it looks like a significant increase has occurred from the FY18 expenditure. Well, that's because in some cases what the state has done is essentially put in a placeholder number until the federal government approves its budget. So at the end of the day, the expenditure likely will not be as high as that number that is sitting in that column. Now, in terms of the enrollment and the number of children served in some of these programs, there was a discernible trend for these four programs in that enrollment has been down. I'm going to separate out the child care assistance program because of the circumstances surrounding it over the last 4 years. As many of you know, the eligibility went from 185% of the federal poverty guideline to 50%. Then it was raised to 162%, then 185, and this year to 200%. So for the 3-year period when there was the decrease and then slight uptick, there was a loss of more than 30,000 children who were previously served by the program. There has been in the last year an uptick in terms of the number of children enrolled in the program. That may be not only because of an increase in the eligibility level, but also, as you'll see later, an outreach program, marketing program that the Department of Human Services is embarking on. Now, with regards to the SNAP program, and this is a trend that is also seen in other states, there has been a decrease. Some of the speculation is that the decrease is partially due to an improving economy. And that may be true in some cases with regards to the other programs. However, I will note there have also been enrollment and qualifying issues related to Medicaid in the state of Illinois. And I just again wanted to touch on the All Kids program for a moment. So if you're not familiar with the All Kids program, it includes the state's Medicaid program for children, the funding received by the state for the Children's Health Insurance Program, and then a portion of the money that is in there is a state-funded health insurance program for children who are not covered by the other two programs. Not only does it represent a significant expenditure, but what's important to note here is that in fiscal year 16, nearly half of the infants, toddlers, and preschoolers in the state of Illinois were covered by All Kids. So again, what happens with this program is significant in terms of the total expenditures by the state and the resources that it may need to meet the needs of young children and their families. And within those All Kids expenditures, I include this chart, both of these charts, not only to show the decline in enrollment, but just under 3% of the expenditures are going towards mental health. And there has been a great deal that has been mentioned about the provision of mental health services to children. So again, that is just sort of a note for the future and just something to consider in the delivery of services. All right, so here we are with the early care and education section. And you can see here the funding increases that have occurred in the Early Childhood Block Grant. Now, again, many of you may know this, but part of that was spurred on by the state's receipt of a federal 4-year preschool development grant of $80 million, with the understanding that the state would provide matching funds. The allocation of those funds, as was referenced earlier, does largely occur on a competitive basis. However, there is language in state statute indicating what percentage essentially goes to the Chicago public schools, as well as the percentage of the grant that is to fund programs for children between the ages of birth and 3 years old. And these two charts represent the number of children who have been served by the Preschool for All program and the Prevention Initiative program, the two programs that are funded under the Early Childhood Block Grant. Now, while those have shown some increases, what's interesting to note is that the enrollment and the funded slots for Head Start have decreased. And part of that may be because of the increase in funding under Preschool for All. Part of it may also be federal guidelines to try and convert from part day to full day and to emphasize serving younger children by converting the slots from Head Start to Early Head Start. And before I showed you the total numbers for the Child Care Assistance Program, I wanted to show you how much actually goes for children under the age of 6. It's about half of the costs, but the Department of Human Services was not able, unlike the full picture, to break out that particular demographic expenditure by the state and federal line items. And you can see here the trends that have occurred with regards to home visiting and early intervention. Okay, so a little bit on fiscal year 20 and what transpired. You can see that with regards to the early childhood block grant, there was a $50 million increase. With regards to early intervention, there was an increase of $12 million in general revenue funds. In terms of state general revenue funds, Child Care Services received a $28.8 million increase. And then again, you can see some of the trends here with regards to home visiting and TANF. Now, what that translates to, in some cases, for DHS, it means that certain early intervention services are going to see rate increases. It means that there will be a cap with regards to co-payments for the Child Care Assistance Program. The state, recognizing the drop that had occurred with the changes in eligibility, is embarking on a marketing program to make people aware what the current eligibility level is and that the service is available. And as we mentioned here, the income eligibility guideline is now up to 200% of the federal poverty level. With regards to the Department of Children and Family Services, it means funding additional caseworkers and in certain circumstances, an increase for certain services. All right, some considerations going forward. Again, some of this has been referenced earlier. This is a map that was produced by ICAM in Champaign. And what it's showing is it is comparing the number of low-income children to the number of funded Preschool for All expansion, and Head Start slots. And you can see, particularly in the red areas, that there is a shortage. So the question here is, again, is the competitive bidding process the correct process? Why are some of those ratios below 1 in some areas of the state? And I will also add that in addition to taking a look at how the resources are allocated, there's a changing demographic picture that's been occurring in Illinois. So there are certain regions of the state where the African American population has declined, and the Latinx population has increased. And so part of the question may also be, are the programs and facilities in the location to currently serve the need of children in those areas? And also, are the staff meeting the linguistic and cultural needs of those children? Here's another question when it comes to the allocation of resources. According to the Center for American Progress, 59% of people in Illinois live in a child care desert. So again, part of the question is, where are the centers? Where is the population that needs the services? And in addition, part of what we wanted to note, I wanted to note at least in this particular chart, was that center-based infant care is nearly 23% of the state median income, and there has been a decline in family child care homes since 2010. Now, just one thing again about allocation of resources and how the money is used for the child care program. If you are somebody who is seeking child care services in the evening, weekend, or overnight, you're much more likely to find it in a family child care home versus a child care center. And yet, if you take a look below for fiscal year 18 at the quality levels, you can see that there are far more centers that are at the gold or silver standard than home-based centers. Okay, the Referenced Funding Commission is looking at the funding streams, but as that has been going on, the state was awarded a preschool development grant, and the purpose there is to take a look at the needs that exist for children across the state and how we deliver those services and whether there is another way of coordinating those services. And again, this is just another method of taking a look at the services we have. Well, I do have to add before we conclude this presentation that when you take a look at expenditures for the state, and you have to take a look at the programs and expenditures for young children and their families within the context of the total state budget. After K through 12, pensions make up the largest payment that the state made out of general revenue funds. And based on the certified annual contribution reports that have been filed by the pension systems, we are looking for next year at an increase of $538 million, of which approximately $500 million in general revenue, if we make the full contribution, will need to go towards pensions. Also sitting out there is approximately $6 billion in unpaid bills that the state has to make good on. So the Governor's Office of Management and Budget earlier this year, taking into account the pension increases, the promised additional revenue for the evidence-based K through 12 formula, and other spending trends, has projected that absent new revenue going into fiscal 21, we are looking at a deficit of $1.77 billion. And part of the question in February, when the governor provides his budget address, is how is that hole going to be closed? Because again, you cannot do it based on some future action that may occur. You have to do it on current law and current revenue. He has, for planning purposes, if state agencies have submitted their budgets to the Governor's Office of Management and Budget to put it all together, requested that each agency provide a budget that has a 6.5% cut. I also have to mention the impact of the census. Census data is used by more than 300 federal programs to distribute some $1.5 trillion. And earlier I mentioned that of the expenditures that the state makes on programs and services for young children and their families, more than 2/3 of that money is federal funds. And it impacts everything from Head Start to child care, the school breakfast program, Healthy Start. This entire list, you can see the impact there could be if there is a significant census undercount of young children. And young children tend to be the largest group that is undercounted in the census. In fact, the state of Illinois had the 6th highest undercount in the country in 2010. And research by another group has shown that the city of Chicago has had one of the highest, has one of the highest percentage of children living in hard to count census tracts. So when you take this whole report, again, I would suggest to you that you can utilize it to look at spending in one area relative to another. You can take a look at whether the appropriations are increasing or decreasing, keeping in mind that if something looks like level funding because of inflation, it may actually be a decrease. There is the question of how the funds are actually appropriated across the state, such as with the Early Childhood Block Grant Program or child care. And then the question becomes, based on the risk factors that one sees in the full risk and reach report, are we effective in how we are spending the money? And is there another way of perhaps contemplating the delivery of services? And with that, we'll stop and be happy to take any questions.